Hello, my name is Alice and I am a consultant obstetrician at Liverpool Women's Hospital. We know that there are some healthcare workers who are concerned about whether or not to have the COVID-19 vaccine, either because they are currently pregnant, hoping to become pregnant in the near future, or breastfeeding. Current advice from both Public Health England and the Royal College of Obstetricians and Gynaecologists is that you can have the vaccine, but it is your choice whether or not to do so. For the majority of women who get COVID-19 during pregnancy, their symptoms will be mild to moderate, but for some women they are more seriously affected, and they are at an increased risk of complications for both mother and baby, particularly in the third trimester. If you would like any further information or to discuss this further with a healthcare professional, you can do so either by contacting your vaccination team or the maternity trust with whom you are booked. We would also suggest that you do this if you become pregnant between your first and second vaccine doses.
Hello, my name is Andrew Drakeley. I'm a fertility doctor at the Hewitt Fertility Centre at the Liverpool Women's NHS Foundation Trust. I'm here to share my understanding with people who are trying to either plan or trying for a baby. So what do we know? Well, catching COVID and being acutely unwell is not a good thing. And it's unclear until you have it whether you're going to get a mild infection or a very severe one. No vaccine, and certainly not these, has any evidence that it actually causes infertility. And coronavirus is a respiratory virus, so unlikely to have any effect on the reproductive system. A number of vaccines are coming online at the moment, and we're quite fortunate in the UK that we have access to vaccines. Most of these are killed or inactive vaccines, and they're not live attenuated vaccines where you give a small amount of the actual disease. And there's been no issue with any previous vaccine that has killed or inactive in the past. Most of the protection comes from the first injection, roughly 60%, with approximately another 30% coming with the second dose. And whereas most of the manufacturers advise a repeat second dose after about 4 weeks' time, the UK is adopting a policy of up to 12 weeks to try and vaccinate as many people as possible. None of these vaccinations have been tested on pregnant women. So therefore the manufacturers, understandably and for regulatory reasons, have to advise avoiding pregnancy because they've not been tested. If you do conceive a pregnancy, then follow current advice, which is unless you're in a high-risk group, don't have further courses of the vaccination during that pregnancy. However, and there is a defined list on the government website, if you're in a clinically vulnerable group, probably the benefits far outweigh the risks of having the vaccination. Good luck and all the best. Bye-bye now.